Hello, I am Lola and with me is Jugnoo. We're very pleased to be presenting this work on behalf of our research group at the UCL, Great Ormond Street Institute of Child Health, and on behalf of our collaborators in the British Childhood Vision Impairment and Blindness Study Group. The British Childhood Vision Impairment and Blindness Study, or BCVIS2, is the only national study anywhere in the world which has investigated the UK incidence, causes, temporal trends, and pathways to detection for children with new onset visual impairment, addressing an evidence gap highlighted by the World Health Organization Lancet commissioned report on global blindness. We reported that the majority of these children have additional non-ophthalmic impairments or disorders, so this is very much complex neurodisability. The mortality rate for infants with vision impairment and blindness is 4 times higher than for unaffected infants. This is a particularly vulnerable population. And there's strong socioeconomic patterning, with children living in deprivation, or those from minority ethnic backgrounds, being much more likely to be diagnosed with visual disability. The majority of diseases which cause childhood blindness remain unavoidable, i.e., not preventable and not completely treatable with current knowledge, partly because the largest population of affected children are those with cerebral visual impairment. Our findings also show that although childhood visual disability is not increasing in incidence, it is increasing in complexity.
Coming then to our recently published paper in Developmental Medicine and Child Neurology, in which we investigated the broader management of visually impaired children in the first year after diagnosis, we found that at this point, 1 in 3 children had not received the recommended assessment and subsequent care and input from a multidisciplinary team. 2/3 had not yet received the recommended education, health and care plan, and 1 in 5 had not yet received a certificate of visual impairment despite being eligible. Taken together, these findings mean that there is evidence of significant underprovision of what is already recommended care, and this care is intended to support early development and future trajectories for the affected child, and therefore the underprovision is likely to have important implications. Our findings show that families do need additional support from all managing clinicians to be able to access and benefit from recommended multidisciplinary care. This need is already pressing and is relevant internationally, as the population of children with vision impairment, severe vision impairment or blindness can be expected to grow in size and complexity globally as child mortality decreases and there is increased survival, in particular of those born preterm and or with complex neurodevelopmental conditions. We'd like to end by thanking our collaborators and co-investigators, as well as the funders who made this research possible. We'd of course like to thank you for listening, and if you'd like to know more about this particular study or any of other research that we've undertaken or work that is in progress, please do look out for our webpage by searching for the Vision and Eyes group at UCL.